Good morning to one and all. Pranamas to His Holiness Sri Jagadguru Shivaratri Deshi Kendra Mahaswamiji. I welcome you for the Rachanavadhana 2020 exam orientation program. So today is the 6th day of guest lecture series. So today we have with us Dr. Gururaj D. Jagirdar Sir, Associate Professor, Department of Sharira Rachana, SDM Institute of Ayurveda, Bengaluru. I welcome you, sir, on behalf of Department of Sharira Rachana. Sir did this BAMS from AV Samiti's Ayurveda Mahavidyalaya, Bijapur, MD from NK Japshetty Ayurvedic Medical College, Bidar, and he is pursuing his PhD from Tilak Maharashtra Vidyapit, Pune. He has participated in various seminars and has been published many scientific papers. Sir has been recognized as a resource person and guest speaker in several prestigious platforms. Now, Sir is going to speak about the topic Central Nervous System. We are honored by your presence, Sir. Now, I request you to proceed with the session. Over to you, Sir.
Thank you, madam. Thank you very much for a nice introduction. Uh, Good morning to all. Om Shri Manjunataya Nama. Om Shri Dhanvantare Nama. Warm good morning to one and all. Respected Dr. Sarveshkar Sir, Principal, JSS College, Mysore, Dr. Alka Madam, Dr. Shelly Sir, and Dr. Chaitra Madam. So myself, Dr. Gururaj, working as an Associate Professor in the Department of Sharira Rachana, wants to give a brief idea about nervous system, which makes most of the students nervous while reading and while attending the exams. So we'll make you the nervous system without nervous. We'll try to make it in a simple way. In simple way, we'll try to understand that. So first we will start. Let me share the screen, madam, for 1 minute.
Yes, sir. You can share.
Madam, screen is visible?
Screen is visible, sir. You have to maximize.
Yes.
Presenter. Yes, sir. Now
Yes,
it is
ma'am.
visible, sir.
Okay, thank you.
Yes, sir.
Thank you, madam. So, first of all, students, UG students should know the syllabus first. So, without knowing the syllabus, you cannot proceed further. I observed so many students studied only the textbooks continuously without knowing what is in the syllabus. So, first you try to focus what is in the syllabus. So, in the syllabus, nervous system comes in the B part, second paper B part. In the B part, total it will carries for 50 marks. So among that 50 marks, 3 points are there: one nervous system, sensory organs, and surface and radiological anatomy. While teaching, we focus on the nervous system more, whereas sensory organs and radiological anatomy also carries the same important marks in the examination also. So while attending the exam, so you should think, so questions will come from the sensory organs as well as surface and radiological anatomy also. One or two questions will come compulsory from the radiological and surface anatomy. If you know this point, then you can pass in the examination very easily. Try to remember this point. So I think you all know this pattern of the examination is here. 10 marks, 2 questions will be there, 5 marks, 10 questions, and 3 marks, 10 questions will be there. Total of 100 marks is there. So while attending the exams, time management is very important now. So most of the students complained that the second paper we studied very well, sir. We know each and everything, but unable to manage the time. For especially anatomy 2 paper, time management is very important. So to know the time management properly, you just differentiate for how many marks or should I write. So total 100 marks paper is there. So it will give some 180 minutes. So 1 mark you should write about 1.8 minutes. Within that you have to complete. So it tells that 10 mark for 10 mark question. So one question carries 20 minutes. You should not write more than 20 minutes. Many students know that they studied cerebrum very well. So if cerebrum was asked, they are go on writing. They know what they know, they will go on writing. So at the end what happens, they may lose the time for writing the other questions. So to avoid such things, you should restrict yourself for the 20 minutes there. And for 5 minutes, 5 marks question, 9 minutes only you should complete within that one. And for 3 marks question, within 5 minutes you have to complete. So in this way, if you calculate, you will get to 180 minutes that within you are going to cover within a 3 hours. So time management is very important while appearing for the especially second paper, when there's part of a nervous system or as also part A also very important. So here we focus mainly for the students is not for hard working, smart work. In the smart work, one word I want to introduce is smart writing. So every student write for the answer in the examination. I know you will fill the paper. You will fill the paper. What you know, you will fill it. But while filling the paper, when you are inking, you just think. Usually, I tell that think before ink. Before that writing, you should know what I am writing. After writing this, whether I am going to get this marks or not. Very important one, especially in the anatomy paper, draw more diagrams. It's a smart writing skill is there. So without diagrams, if you go on writing more and more, you may not succeed what in intention you have written. So you have written everything very good, but diagrams carries more importance in the anatomy. Diagrams tells more, picture tells more about that one. And you have to choose or practice such diagrams which can be utilized in multiple places. You see, remember, when you are practicing and when you are reading, try to observe the diagram. Practice few diagrams. That diagram can be utilized in multiple places. Such diagram should be used. One example in the nervous system, I will tell you, the brainstem diagram is there. Complete brainstem diagram, if you practice that complete brainstem diagram, anterior as well as posterior aspect, this you can utilize if a question comes to the pons, medulla as well as the midbrain also. And if a question comes to the fourth ventricle also, the posterior aspect also you can draw. And the third ventricular portion, the third ventricular portion or the medial side of the cerebrum diagram is there. That diagram, if you corpus callosum diagram is there, if you practice such diagram, can be utilized in multiple places. So you have to choose wisely the diagrams where it can be utilized in the multiple places. So use flow charts instead of paragraph writing. So usually in anatomy, don't go on writing in the paragraph manner. So try to write in the flow charts. For example, cerebrum. So cerebrum having the three poles are there, and borders are there, and surfaces are there. Write it in the flowchart manner, not in the paragraph. It is having three borders, though we don't want that grammar words. So we want the how many borders in front of that arrow mark you put, and go on writing that one. And if it is a paragraph answer, some answers needs a paragraphic answer also. Such answer should be underlined. Very important thing. You see, you are writing one page completely, but the important one you have to highlight. While evaluating, the teachers evaluate at the time, they you want to show the things. So how the director, in the film, in the movies, director shows what the audience wants to know, what the audience wants to see, that one. That way he will show only. He will focus on the main character. The other characters he will hide it. When you are watching any movies, in the song you observe, there are a lot of people are dancing behind the hero and heroine, but all they are going to be hidden. Main focus, camera is focused on only the main person. Like that, in the paragraph, complete one paragraph or one page, you have to highlight the important words. You have to choose such words, and if you highlight, then it will get more marks for that one. And very important, solve the previous question paper. This is very important. Why your students will do? So they will study very well. I know you study very well, you involve in the studies, you read it, and while how to represent it is a problem for you. So how to represent it, how you have to practice yourself. For that you have to solve the previous question papers. Only you have to solve it within a time, sit and write, and you come to know what to write in the answer big. So what to I have to write to get more marks? After writing, you evaluate yourself. Don't go for the teachers for evaluation. You come to know, you studied very well. So you know these points. You just evaluate yourself. Smart evaluating. There is a smart writing also, smart evaluation process is there. So we'll teach the smart evaluation also. Evaluate yourself whether I am by this answer whether I'm going to get more marks or not. Like that you have to involve in such things. So smart writing. So everyone is reading cerebellum or any point. They have read everything, but focus on writing mainly. So you know very well you have more arrows in your pocket, but you are not hitting. For Ashtanga, I usually tell my students that they know very more number of shlokas, but when it comes to the examination they are not at all writing the shlokas because they don't know where to use the shlokas. So in anatomy also, you practiced several diagrams. So for journals, what we give now, you practicing several diagrams, but where it can be utilized, that you should know very well. So try to use the technique of a smart writing. So when it comes to the nervous system, just brief introduction I have given how to write in the examination. Will come for the nervous system because as you know it's a very vast topic. But for the syllabus point of view, they have given in a only single word, brain and the spinal cord, detailed study of the brain and the spinal cord. It is bigger one. So first try to identify the probable questions. Try to identify in the nervous system, try to identify the probable questions. Go on solving that one. If the examination, when it comes to the nearer, what you have to do is first you have to identify the probable questions. That can be, you can find it in the previous year question paper, or you can meet the teachers and teachers will guide you. Madam is there, Shelly sir is there, they will guide you which are the probable questions. They have a huge experience, 10 years experience, 12 years experience is there. They will guide you, these questions will come probably. So among that you have to choose such questions, go on answering for that one. So it is not a big task. So you have all PUC, you have cleared all PUC. It is a more than BMS. So usually I said to my students, it is very tough. Compared to that one, it's the easiest one. But what you are doing, you are not planning properly. So if you plan properly, you will definitely, you will success in the examination. So probable questions I had to identify. So in the nervous system, for first probable questions, define neurons and its classification will come. So neurons, first you have to write whenever questions come. So try to read it properly here. So students, what happens? Two types of the questions will be there. First one will be definition and it's a classification. So you have to focus what for both. So for how much marks it has been asked, whether it has been asked for 5 marks or 3 marks question. Depending on that, your writing should be there. So if it is only for 3 marks, simple definition, classification should be on the basis of the flow chart, it should be there. But if it is on the 5 marks question, you should go on enlarging, like multipolar cells. So these multipolar neurons, most neurons are present in the CNS. They are the motor neurons. Like that description is needed if it is asked for 5 marks question. If it is asked for 3 marks question, only name is enough. So remember students, always try to put all the points whatever in the text is there in the shorter form, not in the longer form. You are not going to write any new text in the your answer booklet. What you are doing, you are representing a text there. You are representing the text what you have read now. You represent in a very minute form, anu form, not in a bigger form. Don't go on explaining us, because the teachers, those who are evaluating the teachers, they know. So teachers will know what the students know at this point. So explanation type of the answers is not required. So you have to cover all the points whenever we ask the types of the neurons when classification. So according to their number of the process also you have to identify it. According to the length of the axon also you have to identify it. And according to sensory neurons, motor neurons, like this, a lot of aspects you have to identify and introduce in the words. So if you go on using more words in your answers, so teachers comes to know that, so student knows very well because of shortage of time he has represented like this. So a presentation of answers is very important in the nervous system, because students know very well, but where to present it they going to fail. Do not do that mistakes now. So when a types of the neurons is asked, you go on classify the neurons on functional classification as well as a structural classification. Simple diagrams you can use it, unipolar, bipolar, as well as a multipolar neurons. You just go on simple diagrams, you can draw it. If it is a for a 5 marks question, if it is a 3 marks question, it's just simply flow chart is more than enough is there. So the why I chosen 2 or 3 slides for this one, because so this information can be presented in this slide. What we were seeing, no, 3 types of the neurons: motor, sensory, and interneurons. Such things also can be presented if it is for a 3 marks question. If it is a 5 marks question, in front of the sensory neuron, the receives a stimulus. Again, you have to write something new more words for that. Next one probable question is the defined nervous system and its classification. So here the definition of the nervous system you have to write it first, and its classification. Usually whenever the classification is asked, you try to write it the classification in the base of the complete flow chart. That is very helpful to read for the teachers also, very helpful to remember you also, because if you go on writing in the paragraph manner it is not going to helpful. So nervous system usually classified into peripheral and the central nervous system. Again, the peripheral, autonomic, and the somatic. Central nervous system is the brain and spinal cord. We focus mainly on the brain here. So forebrain, midbrain, and the hindbrain. So again, forebrain is classified into telencephalon, diencephalon, and telencephalon includes the cerebral cortex, basal ganglia, hippocampus, and amygdaloid bodies. Diencephalon includes thalamus and the hypothalamus. Whereas the midbrain is called as a mesencephalon, tectum and the tegmentum parts are there. Whereas the hindbrain is there, metencephalon and myelencephalon. Metencephalon is pons and the cerebellum. Myencephalon is the medulla oblongata. The continuation of the myencephalon is the spinal cord. So this is a flow chart. This you should remember how this nervous system is arranged in that way. Whereas the peripheral nervous system, there are autonomic nervous system and somatic. Somatic nervous system, spinal nerves will come there, whereas autonomic nervous system, whereas the spinal nerves as well as some cranial nerves are also going there. Autonomic nervous system, you will get the sympathetic as well as the parasympathetic one. So usually I tell my students that the nervous system, when you are reading in anatomy, try to correlate with the things with the physiology topic also. In the physiology syllabus also, there is same topic is there, nervous system with its functional aspects. You try to read together. When you read together, you'll get some clinical some information, so that can be utilized as well as in anatomy as well as the physiology. So they are not separate. Anatomy and physiology are the two sides of the same coin. So you should write some physiology aspect also. When you're writing in physiology, you should write some anatomy also. So why I'm telling this, because sometimes if a question comes on the tegmentum or tectum part, student doesn't know about anything about the anatomy. At least he can write about the physiology of that part, at least some physiological part. So yeah, instead of giving a empty pages, just to fill related to the physiology part. So don't go on filling the physiology part more and more. I am not suggesting that one. Just to fill that physiology part, if without giving empty paper, at least you may get half or 1 mark for that one. So attempting, so this is one type of the attempting. Do not write wrong answers. I'm saying write it in the related to the physiology aspects. When you are reading anatomy, nervous system, try to read the correlated physiology also. That is very helpful for you. So some terms you should know. The ganglion is a group of the neurons which are outside the CNS, whereas the nucleus is a term which is a group of the neurons within the CNS. And nerve is a group of the nerve fibers which are outside the CNS. Usually you find the ulnar and radial nerve, all this one, whereas a tractor is there, a group of the nerve fibers within the CNS. For most of the students are getting confusion about these terms. So first try to be perfect in these terms. Once you are familiar with these terms, then go on reading the further nervous system. Why? Because so these terms, when it comes to the while reading, ganglion comes. So what is ganglion? It is group of the neurons outside. Whatever you are going to find outside the CNS is there, you have to tell it is a neurons, group of the neurons which are present outside the CNS. These four terms you try to remember. One more important probable questions will come is called as a cranial meninges. There are meninges is a covering of the brain and the spinal cord. There are two types are there. One is a cranial meninges, another one is a spinal meninges will be there. So this when it comes to the meninges coverings, the membranous coverings, the outside the membranous coverings, bony covering is there. The first covering what we are doing the dura matter. Dura matter, arachnoid matter, and the pia matter. So the questions will, if it comes to cranial meninges, so your presentation will be different. Spinal meninges, slight changes are there, not more one. There is some slight corrections or the changes are there. So dura matter, usually tough one. It's a mother, what we call it, the mother, which is going to protect one. So which is having the two layers, periosteal as well as the meningeal layer. So these two layers are fused. In some places they are not going to fuse, they are a little bit open. In that one there is a fluid is filled, the sinus, what the gap is called as, that gap is called as a sinus. Here you can identify the word superior sagittal sinus, in which there are granulations of arachnoid matter. A web like structure is a spider is extended there, where the CSF flow is possible. In the further slides you can observe that one. So you try to practice in this diagram, not this diagram. If I am chosen because so this you can use it for the scalp layers also. Sometimes you can scalp layers will come. I forget to put one more scalp layer diagram is there. So scalp and was a meningeal layer diagram. You can use wisely two diagrams together, or else a simple diagram. This diagram tells the three matters plus sagittal sinus also. This further one more diagram is there. Just I will tell you. Okay, so see, this diagram help you to identify the spaces also, the subdural spaces, epidural spaces also. Why? Because some questions may be asked for the spaces also. So epidural spaces, 3 marks question. At that time, you instead of writing only one word, so epidural above the dura mater space is there. Like that, you what you are writing in normal one. So that is also right what you written. But if you draw simple diagram, that will be more effective. So what we call putting a pickle on the rice to get the more taste for the food. So like this diagram, so you have to use wisely diagrams in the part where you will get more marks for that one. So the foldings of the dura matter, usually we have a flax cerebri, tentorium, flax cerebellae, and the diaphragm cell. Why these folds are there? To separate the compartments, to separate cerebri will separate the right and the left hemisphere. Tentorium cerebellae separates the cerebellum. Whereas the diaphragm cell is there, pituitary gland and the other rest of the brain is going to get separated. So in the round red mark what I have put, these are the compartments which makes the brain into presenting. So these are the foldings of the dura matters are there. So you should know the basic minimum. Within these foldings you will find these veins, the cerebral veins are going to run. So dural venous sinuses are there. As I told you earlier, the spaces are there, cranial meningeal spaces. The importance between spinal and the cranial meningeal spaces is like this. So the epidural space is there. So it is a potential space superior to the dura mater between bone and the dura mater. It is normally closed, and since the dura is attached to periosteum, which is attached to the inner surface of the skull, whereas sometimes any clinical injuries, any injuries is going to occur, that at the time you can identify this spaces also. Whereas epidural spaces is very important in case of the spinal meninges. In the further slide the description is there, I will show you that one. Epidural space in the cranial meninges, such importance you will not find, but in the spinal one you will find more importance one. Subdural space is there, where is a we usually whenever they use the potential space, the space is there potential, you try to use the word potential spaces, not completely empty spaces are there. So whenever required their spaces is going to be filled, the potential, use the try to use the word, it's a physiological term what we are using, it is the potential spaces between dura and the arachnoid matter, whereas contains the dural venous sinuses. Whereas a subarachnoid space is there filled with CSF. I think you all know the cerebral arteries. The cerebral arteries are going to form the CSF, which is going to be circulate, which helps to float the literally brain in the fluid, which makes a little bit heavy. The total weight, if you calculate, it is 1,500 grams, is lightly weighted. So, if you clinical anatomy, I included this slide. Why? Because if you go on reading complete anatomy, you may get bored there. I'm not related only with the nervous system here. You study any bones also, marmas or any muscles, any organs, only anatomy part, you will definitely you will think it is what to read it. Try to add few clinical anatomy points in that one. Try to read, try to correlate with one. So whenever you visit any hospital or whenever you're talking with any of your friends or parents, some clinical terms you may listen. So such things try to study in your anatomy parts. So clinical anatomy, if you use the clinical anatomy while reading anatomy, definitely you will get more interest in anatomy, and everyone will clear the anatomy in one chance. Why? What we are all doing is we will teach you the anatomy normal, but you are not application of that. You have to apply that anatomy clinically. You have to apply. Why I should read? So you simply study the radial artery, but when you use radial artery, if you study, so try to focus on the radial artery, try to palpate on the radial artery. Why we told to palpate only on the radial artery, not on the other arteries? We are not telling to palpate the other arteries. Why ulnar artery we are not telling to palpate? Why? What is the reason? You have to analyze whether it is palpable or not, why the teacher has told this, why the text has told like this. When you analyze and when the doctors check the radial artery pulse, you just think why they are checking. So why not ulnar anatomy like that? If you analyze and study, if you apply some clinical aspects, that definitely you will learn more about anatomy. You will start loving your anatomy subjects, and anatomy will become easy for you. Otherwise it is little bit, you what usually in the student community it is there, so anatomy is a difficult subject. So actually it is not a difficult subject, actually it is a very easiest subject, which is having more number of the terms. I'm not saying this is not, terms are very less. Huge number of terms are there. So you have to do some dedication for that one. Revise and repeat. Revise and repeat. The same thing. That you have to repeat, repeat, repeat. There is no any other side cuts are there. There is no any other side cuts. If you repeat with interesting like clinical anatomy oriented, surgical anatomy related, uh, living anatomy oriented, if you go like that, anatomy will become very easy for you, especially nervous system, especially when you are studying the cranial nerves. Really students, I'll tell you, when you are studying the complete cranial nerves, because of shortage of 1 hour I cannot complete all these topics right now. Just I'll give a one brief idea. When you are studying cranial nerves, try to study the clinical examination of the cranial nerves. Without that, don't go for the further. First try to study that one, clinical examination, in normal as well as in patients. So if you're not unable to see the patients, your very best friend nowadays Google is there. You are not asking teachers, you're directly asking for the Google, not seeing the textbook. You're not believing textbook, directly asking Google. See, some videos are there, several lot of videos are there, clinical examination. Try to observe that one, you will get some basic information. Use the platform for such one, where you are not able to see the patients, not able to check the clinical anatomy. Try to see one video related to clinical anatomy. Definitely you will learn anatomy very well. So here the hematoma which is going to occur, epidural hematoma, whereas a subdural hematoma, you see the color changes is there. In the epidural hematoma, arterial blood is there, whereas in subdural hematoma the venous blood is there. So the slight changes you try to observe. If you know such small corrections, anatomy comes very easily. The small gap what you are seeing here, the dural venous sinuses, so these are the foldings are there. So this diagram, see this diagram can be utilized for showing the meningeal layers also, as well as the foldings of the dura mater, as well as the clinical anatomy. Try to use such diagrams in the clinical practice while writing. So the, as I said, epidural spaces which is contains in the spinal cord is having the more amount of the space, more fat is there, as a more space is there. This clinical anatomy, clinical related. So epidural anesthesia is going to given in these spaces, because the fat is there abundant, there is no more nerve filaments are not there. So directly epidural anesthesia is there. So you see the epidural and spinal anesthesia. So let's try to identify the difference between the spinal and the epidural anesthesia while giving. So usually they'll tell you the doctor that anesthesia is given, anesthesia, so epidural, so where that anesthetic fluid will enter, what happens there. So try to analyze such things. So if you analyze and read, analyze and study, then anatomy will be much easier for you. So these are the small things you have to remember. One more important question comes to the while writing is the dural venous sinuses. Most of the students miss these chapters because of a huge explanation is there. So there is we are not going to study. So try to study it for a 5 marks or 3 marks point of view. What is dural venous sinuses? They are the situated between the layers of the dura mater. These dural venous sinuses are lined by the endothelium, and their walls are thick board of muscular tissue, and there is no walls are there. In the lower limb veins you will find the walls, whereas here also you will not find any walls. In the lower limb veins you will find the walls are there. What the function is? The function is to receive the blood from the brain through the cerebral vein. Whatever the brain is venous system is there, completely venous system is going to put it into cerebral veins, and some portion from the cerebrospinal fluid in from the subarachnoid space to the arachnoid villi, and directly they are going to drain to jugular vein, internal jugular vein, right and left side of the internal jugular vein. And these venous sinuses are very important for clinical point of view, as for the CSF understanding point of view, as well as the meningeal layer point of view. Try to identify the basic diagrams. So try to practice such diagrams. This is one more diagram where the arachnoid granulations are there, CSF flowing is possible. So that such diagrams you try to practice this one. So when it comes to the sinuses, So dural venous sinuses, usually they are having the pairs are there. This slide I will just focus here, paired and the unpaired one. So paired are superior sagittal, unpaired are superior sagittal, inferior sagittal, straight occipital, three intercavernous basilar plexus. So for 5 marks you have to write what is the definition of the venous sinuses, one diagram of a venous sinuses. Next you have to write the types of the venous sites, a paired and the unpaired one. So among paired one, spinal, cavernous, superior petrosal, inferior petrosal, transverse as well as a sigmoidal one. So among these sinuses, one sinus is very important, clinical related point of view, it is called as an cavernous sinus. So you can identify the position of the cavernous sinus near the, what you are calling it is an cella turcica is there in that side of that one. Why? Because most of the cranial nerves are passing to this cavernous sinus, clinically very important, as well as for the exam point of view also a little bit very important one. How these sinuses are connected with the one another, this diagrams are going to tell. And how at the end all these sinuses are draining into internal jugular vein. So again, this internal jugular vein directly goes to the heart. That all other process you all know this one. From the venous system of the brain directly going into the internal jugular vein is there. That you can identify. So where the exactly the cavernous sinus is there. So you can see the arrow mark what I am mouse arrow is showing here. Cavernous sinus is there. So on the side of the cella turcica, you are going to find this cavernous sinus, because of it is of a paired one, right side and the left side cavernous sinus is there. So why this cavernous sinus is important? Because it is having several nerves or components. The venous sinuses, all this is centrally cavernous sinus is filled with the blood only. Space is there, in this space blood is filled. So through this space only oculomotor, trochlear, abducens, ophthalmic branch 1 and maxillary V2, and as well as the artery, internal carotid artery is going to run. And if any infection in the cavernous sinus, that may affect to these nerves. So if you know this one, cavernous sinus very clearly, then understanding of the other. See this diagram. When you are practice, if you practice this diagram, as I said, smart writing. Well, multiple. If a question comes to the abducent nerve, I know only abducent nerve, only 1 or 2 points, but I know this diagram. You just draw this diagram. Abducent nerve is related in the cavernous sinus at this junction or point. It is also right. At least instead of giving us empty paper, you will get some marks for that one. So if trochlear nerve is asked, I don't know anything about the trochlear nerve, but I know the diagram of cavernous sinus where the in the cavernous sinus where the trochlear nerve is coming. Draw this diagram. Show that the relation of the trochlear nerve and the cavernous sinuses. At least you will get 1 mark. I not studied any. See, some student tell I not studied cranial nerves, sir. No problem. You just these diagrams, this diagram, if you practice, so you can use this diagram while writing the cranial nerves. So simple. And if you are studied cranial nerves very well, but not cavernous sinus, when you are studying the cranial nerves, this diagram will come again. So at that time, use this cavernous sinus anatomy there. So try to utilize the single diagram in multiple places to get more marks to avoid complications. So why, as I said earlier, this is very clinical important because it connects to the external veins. It is going to connect it to the external veins, external facial veins as well as the ophthalmic vein. Any infection in the outside the venous system, any infections in the outside one, directly they may enter into the brain or the this cavity. It's very dangerous. So to avoid such things, so cavernous sinus is very important. The diploic veins are there, emissary veins are there. There are two sets of the veins which are present in the nervous system when you studying will come. So diploic veins and the emissary veins. These are the emissary veins. They connects the external vein as well as the cerebral vein. Externally veins are there and cerebral veins. They are connected with the one another. through the emissary veins, they are going to come and infections directly enter into the cavernous sinus. Very important one. Next, simple one. This one I'm just glancing all this, I'm not going in detail. So clinical, why I'm focusing some clinical aspect, because you should create some interest among these topics while reading. Once you read, you identify it for a which marks point of view. Next question, next topic comes is the spinal cord. First, when it comes to spinal cord, it's a huge chapter, big chapter. Now, if you go on reading, it takes more time. So first, analyze spinal cord for 3 marks. What are the probable questions are there? For 5 marks as well as a complete 10 marks. If spinal cord is asked, simple question, spinal cord is asked for 10 marks. What should I write? First, note it down. So before writing, you note it down, what are the points I have to include. Then you go on filling that one. This is smart writing. So go on, don't get the question paper. When you read the spinal cord, don't go on writing. For 10 marks, what should I write, what should I include? From definition of the spinal cord to the clinical anatomy of the spinal cord, you should include all the points. Remember, you should include all the points with minimum. If it is a 10 marks question, if they asked only spinal cord external features, spinal cord internal feature, so then you have to focus only on that one. This is a gross. Nowadays they are not asking such questions, gross one. If gross question is asked, you can write in all the aspects, you can get more marks, no problem in that one. But particularly some students fail in that particular questions. For example, there is a cauda equina is asked. Cauda equina is asked, you have to write only related to the cauda equina, not any other thing. So at that time, you should be little bit focused on that. Related terms here and there you can write, but exactly what is cauda equina, all those things you have to write. So here, probable questions you try to write. Here I just focus only 5 questions. Not only these are the previous year question papers what I got, I have written. And not only this much, they will get lot of the questions are there. Try to solve the previous year question paper. Try to note it down, what are the 3 marks questions will come in the topic called as a spinal cord. That you choose it, then go on answering that one. That will help you to study clearly. Again, same thing, the 3 marks, there are 5 marks. The external features of the spinal cord, internal features, name of the tracts of the spinal cord, and pyramidal tracts with the clinical importance. See, such questions you should know. Pyramidal tracts are there, motor tracts they will come, motor decussation. In the question paper, different terms they will use. Sometimes our students, what they will do, they know the answer, you know very well the answer, but the question name is difficult. 2 or 3 names we will teach you at the time of class, you will remember only one. If different is asked from the examination in the question paper, you forget that, but you know the answer. After coming out of the examination hall, you will tell, oh, I know this answer but I couldn't write. So that, for that reason I am saying, try to read the previous year question papers or more and more, and discussion in this chapter what are the questions will come. So now a simple diagram when a spinal cord comes. One, two diagrams you practice. One is for the internal feature, one is for the external feature. So you should not, without wasting time, you just do 2 diagrams, you practice that one. That will help you to study about internal as well as external diagrams. So if you take a section of the spinal cord, as you know, the number 1 is the anterior median fissure is there, and posterior median sulcus is there. Anterior median fissure and posterior median sulcus centrally. There is an 8th number is called a central canal where CSF is flowing is there, and this H-shaped one thing, butterfly shaped structure, what you are seeing, it is called as an gray matter, where this gray matter is divided into 5, 6, 7, 3 parts according to their position, called as an anterior horn, posterior horn, as well as a lateral horn is there. Whereas the white matter is again the outside, which is outside the gray matter. Here 9, 10, and the 11 is there. So 9th is the anterior white column, 10 is the lateral white column, 11th is the posterior white column. So the gray matter is the group of neurons are there, cell bodies are present, whereas the 9th and 11 completely tracts are there. Completely tracts you are going to find some in that area. The number three is the gray commissure, where the gray matter of the right and the left side is going to meet the gray commissure, and the fourth one is the white commissure is there. So this basic diagram, if you remember, when it comes to the blood supply to the spinal cord, I have not included in this slides also, and the further slides also. Try to time to tell you. So when it comes to this, you just draw a surrounding diagram where the blood supply to the spinal cord. Simple diagram. If you know this basic diagram, then you go on adding the further points. Spinal nerves also can be drawn with the help of these diagrams. So if you observe the external feature, what are the points I have to write in the first impression to get more marks? The length you have to write, the diameter, weight, all things you have to write. And you have to write extension from downward continuation of the medulla oblongata. So from first cervical vertebra, from it is going to start, where it is going to end, conus medullaris. Conus medullaris is continuous as a phylum terminale. It's an end part is there. The total length is about 45 centimeter. In female, it is about 42 centimeter. Compared to the length of the spinal cord, the vertebral column length is more. So vertebral column length is about 60 centimeter compared to the spinal cord. So because of this one, spinal cord is going to end in this conus medullaris portion only. The further portion is the vertebral column with the spinal nerves are there. So this you should remember. Again, there is one question will come, the level of the spinal segment and the vertebral levels. 5 marks question or 3 marks question. This is a very basic. Once you know the level of the spinal segment and the vertebral segment, also you have to highlight that one. And the spinal cord is enlargements. The two enlargements are there. Why it is called as a cervical as well as a lumbosacral? Why these enlargements? For to enclose the more number of the motor neuron to supply the upper limb as well as for the lower limb. This at these places the circumference is little bit more, 38 millimeter at C6 level, 35 millimeter at the S1 level. Usually if you see, the spinal cord looks like a soda bottle, glass soda bottle is there like that. In two places it is having little bit enlargements are the cervical and this one. So because to accommodate more number of the motor neuron. What is phylum terminale? At the L1 lower end of the spinal cord, that is conus medullaris continuous as a phylum terminale. Its length is about 20 centimeter. Phylum terminale interna is about 15 centimeter in length, which lies in the dural sac. Phylum terminale externa is 5 centimeter in length, which lies outside the dural sac below the S2. So see, try to write this much only, not more than that much. Do not write, go on writing whatever explained in the textbooks in a diagram, in the paragraphic manner. Try to write it in the simple form. So 20 centimeter bifurcation, 15 and 5. 15 is called as a phylum terminale interna, 5 is called phylum terminale externa. So like that, if you draw a simple diagram of this one and written, 3 marks is in your pocket. You want to get more marks, 3 marks in your pocket, you have to study like this. If you are not able to get more marks, you go on writing in the paragraph manner, you will not get. So try it in a smart plan, smart diagrams, simple diagrams try to draw. So everyone knows simple diagrams. We are not asking you to take the scale and measure according to engineer scales, what they will do, building well, making building the measurement scale. Such things we are not asking. Simple diagrams, schematic one, which helps to able to identify that you have studied. We are checking you. So teachers are evaluating you. Teachers are want to know that whether you know the subject or not, like that. So Coda equina, again 3 marks question as I said. The nerve roots of the 5 lumbar, sacral and the coccygeal nerves will take an vertical course to to form a bunch of the nerve fibers around the terminale. So like this simple diagrams, this diagram can draw anyone. This diagram can be drawn anyone. We'll come to know that student knows what is the cauda equina, what are the contents of the cauda equina. And when you know this one, when you know the cauda equina very well, some clinical aspects like lumbar puncture, such words should be there in your answer to get more marks. Why? Because clinical importance also you have to fill there. At least you are not writing the anatomy detail, so some students may difficult to remember all these points. At that lumbar puncture they can remember, lumbar puncture procedure where they are doing some clinical aspect they can write. So try to use use wisely to get marks there. Some factors which are protecting the spinal cord. For this sometimes may be asked for 3 marks question. So bony cage of the vertebral canal, spinal meninges, and hydrostatic question of the CSF. Whereas the factors which keeping the cord in a position, which is rostral continuity of the medulla oblongata, caudal fixation with the phylum terminale and the cauda equina, and lateral suspension with the ligamentum denticulatum. So see, ligamentum denticulatum is again a 3 marks question which is asked several times. So try to remember the extension or the some corrections changes in the diameter extensions in the vertebral column is there, so that you have to remember. Some modifications are there, try to remember that one. When it comes to the spinal cord, 5 marks question, you will get the cell groups, neuronal cell groups which are present in the spinal cord, the gray matter. So you will find a lot of gray matter diagram. So try to use a diagram where you can show the laminar arrangement as well as the white matter laminar arrangement as well as the cells arrangement also. So the total cells are arranged in the ventral area into ventromedial and the dorsomedial, and phrenic and accessory in the central part, and the lateral aspect, three set of the group of the neurons are there. Groups will find one is the anterior lateral, posterior lateral, and the post posterior lateral are there. Whereas in the dorsal and the lateral column you will find intermedial nucleus and intermedio medial. One is on the medial side, one is on the lateral side. Such nucleuses you are going to find. Whereas in the lateral posterior aspect, so dorsal nucleus, nucleus proprius, substantia gelatinosa, and posterior marginal nucleuses. So such nucleuses you are going to find in that one. So try to remember. I say why you have chosen second diagram. So in this diagram, whereas empty is there, the gray matter empty is there, try to fill the nucleus's name here. Try to arrange the laminar arrangement. In sometimes they may ask you the 3 marks question, draw a diagram, neat labeled diagram of laminar arrangement of the spinal cord. At that time you can draw. Next they may ask draw a neat labeled diagram of nucleuses in the spinal cord. At that time you can use. So practice this diagram. So you go on putting these nucleuses, what you are seeing in this right now, this diagram, put these nucleuses here and name it. So that diagram will be more helpful, which is going to helpful for the study one. When it comes to the tracks here, there are tracks or ascending tracks, descending tracks, go on, remember. In the flow charts, in the upper and lower arrow mark, if you go, then you can easily remember the tracks here. And the tracks usually they studied in the chart wise better. You try to really study in the chart wise. So first the uh, name of the one, and function, where it's a crossed and crossed, where it begins and where it terminates, and what is the function as that one mode of second point is there. So that is very important. So try to write it in the chart. So whatever simple one, simple to create in your own understanding, simple one, I just taken it from the textbook, I just put it here. So we don't expect you to write this much in the examination. Simple lateral spinothalamic tract. So it is present on the lateral side. While reading, you have to, it is connected to spinal cord and the thalamus. What it is to do the function is pain and temperature of opposite body. So like that, analysis and study that will be help you. So such chart should be there in your answers, so to get more marks. And while reading also, try to prepare such charts that will help you to grasp easily and little bit fast one. The same one, descending tracts also, you made some charts there. So next comes to one more big topic. It is the cerebrum. Now we discussed only up to the spinal cord. Just I'm giving the only basics what you have to read and how to read also. I think you all read that one. Now it is a time when it examination time. So don't do the Yuddha Kale Shastra Abhyasa. So you all did studied all very well now. Now it is a time to plan, execute the plan. So while execution, you analyze like this. Cerebrum, same thing. What are the 5 marks question? What are the 3 marks? If what diagram I should practice? Where should use this diagram? Like that, analyze before studying the cerebrum. Survey the cerebrum part first. Survey the complete chapter, but just analyzing that one. Once you saw the each and every page of the cerebrum and you have your notes or textbook, then analyze what questions are probable, go on answering that one. So sulcis and gyres of the cerebrum, functional areas of the cerebrum, white matter of the cerebrum, what all there, that all you have to identify. For sulcus and gyrus, simple diagrams. So definition is there. 3 marks question they may ask, the sulcus is there. What is gyrus? 3 marks question. Simple diagram. You draw it and you will get some marks there. Okay. Sulcus. What is a sulcus? Is an depression or fissure in the surface of the brain. Whereas a gyrus is a ridge or on the cerebral cortex. It is generally surrounded by one or more sulci. It is a hills. It is a up grading is there. So why the sulcus and gyruses are present in the cerebral cortex to increase the surface area of the brain. So what we are having, the surface area of the brain is little bit short. To increase it, the nature made us into a sulcus and gyre to accommodate more number of the neurons. So this sulcus complete 1/3 portion is only exposed. 2/3 portion of the brain is hidden only inside. It is in the sulcus only. Only what we are exposing is only some portion, 1/3 portion. The rest of the portion we are not at all using, that are all hidden. The hidden one is in the sulcus form. So that you try to remember. Next, the parts of the brain. 5 marks question they may ask the parts of the cerebrum. Every 10 marks question also such things will come. Occipital, frontal, temporal, the poles. As I said, the 3 poles are there. So for a 5 marks question, just give in a 3 arrow like structure. For a 10 mark, if the same question is asked, frontal pole is related to the frontal bone, temporal pole related to the temporal bone, occipital pole related to occipital, simple one. You know the bones name, try to relate, try to enlarge your answer for 10 marks question. For 5 marks question, write it only 3 names is more than enough if it is a parts of the cerebrum is asked one. Next, lobes of the brains are there. So frontal lobe, parietal, occipital, temporal, as well as one more hidden lobe is called as an insula. Is a hidden lobe which is in the which is called as a Sylvian fissure, or the lateral sulcus is there. In that portion it is hidden. What you are seeing, the central portion is an insular lobe is there. Next, when it comes to the diagram called as a sulci and gyres on this cerebrum, 5 marks question. So simple schematic diagram is more than enough to explain the things. So 3 diagrams. First diagram, this is on the lateral surface, this is on the medial surface, this is on the inferior surface. See students, once you are familiar with these, you will not forget. You will not forget. See, it's simply making a mapping. You are making a maps on the brain. So what are the parts are there? So how you on the globe you will make, these are the countries, The same in the brain. So this part is related to superior frontal gyrus, middle frontal gyrus. So these are the borders which divides, like superior frontal sulcus and inferior frontal sulcus divides into three portions. Like that, you have to read like that. Then it will be more helpful, more easy to study. These are all 5 marks question. Simple schematic diagram you practice and go on writing. That will be helpful to get the complete marks. Try to practice three diagrams without fail. Without fail, you try to practice these three diagrams to understand the sulcus and the gyrus there. Okay, these are the three sulcus and the gyrus. Yes. Next comes to the white matter of the cerebrum. Shelly sir, uh, madam, Chaitra madam is there? Madam?
Sir?
Madam,
Yes,
audible
sir.
now? Madam,
Yes, sir. It is audible.
it's
Audible, sir.
11. It's 11 o'clock. Is it okay or
It's
to
okay, sir. You continue, sir. Please
madam?
continue, sir.
This slides are more because I'm just with shortage of time. I will limit to the only cerebrum right now, madam. Okay.
Okay, sir.
Uh,
Okay.
uh, thank you. Thank you. So when it comes to the white matter of the cerebrum, so gray matter and white matter, when it comes to the gray matter and white matter of the cerebrum, two portions. A gray matter group of the neurons are present. White matter is the tracts are there, fasciculi are there, lemniscus, peduncles, commissure. All these are one at the same time. When it comes to the nervous system, when teacher comes and start talking all these terms, what are all these different? No, they are not all same only. The meaning is same. Try to identify its root meaning there. So group of the nerve fibers. Here group of the nerve fibers outside you are calling it the nerve only. Simple. We are not calling any other new terms there. But here in different names we are using that one. And the myelination is going to seen in case of the white matter is the oligodendrocytes, whereas in the CNS, whereas the Schwann cells are there in the for the PNS. The collection of the nerve cell bodies within the white matter is called as a nuclei. Remember, this nuclei term again comes here. So there are a lot of nuclei, basal nucleus, head ganglions, like that. Such terms comes to nervous. So when you see the classification of the nerve fibers are there. So the three types of the nerve fibers, because neurons are there. One neuron has to connect it with the one other neuron. So for that connection, we require some fibers are there. These fibers are of association fibers, which connects the different cortical areas of the same hemisphere. The right hemisphere speaks with the only the right hemisphere. Whereas the commissural fibers, what happens? They connects with the other areas of the hemisphere, right and the left one. Whereas the projection fibers are there, they connect with the cerebral cortex with the subcortical gray matter. The cortex, what we are speaking is a cerebrum having the outer external layer is there, cortex. Below the cortex you will find the subcortical gray matter is there. There is a basal ganglia are there, thalamus is there, brainstem, spinal cord, the rest of the brain. All these fibers, any fibers which are connecting, they are called as a projection type of the fibers. So three types of the fibers you will get. One is the association fibers, commissural fibers, and the projection fibers. So you can see this red color, what you are seeing, the fibers are there. So these are the connection between the one neuron to the another neuron in a different portions. Different areas are there. So association fibers are for long association fibers are there, short association fibers. Among that uncinate fascicles, cingulum is there. These are the long association fibers are there. Again, one is the commissural fiber, very important for 5 marks point of view, the student. Why I focused this chapter? Because the white matter of the cerebrum. When in this topic, you will find a question called as an fibers of the white matter. What are the fibers are there? What are the tracts of the white matter? And among that, three types you have to remember: association, projection, and the commissural. Among the commissural, first and important 5 marks point of view is the corpus callosum. Very important 5 marks point of view, corpus callosum. Next, other examples for is the anterior commissure, posterior commissure, hippocampal, and the habenular commissures are there. Among that, corpus callosum is very important for 5 marks point of view for undergraduate students. Commissural fibers, as the name indicates, it communicates with the right and the left hemispheres. There are two types are there, which if they connect with the identical areas, the ear, the related to the hearing center, two hearing center of right side and left side, there is a homotopical. If they connected with the one hearing center, one visual center of opposite side, then it's called as a non-identical heterotopical. So homotopical and the heterotopical is there. So what this corpus callosum? It is the largest brand of the commissural fibers, which connects the wide areas of the neocortex, except the lower and anterior parts of the temporal. Except this portion, all the above portion are connected with the corpus callosum only. It is very well developed in man. 300 million finely myelinated fibers, because the right brain and left brain, the speaking, usually when we are study, when we are doing that, what your right hand doing, the left hand knows. What your left hand is doing, right hand knows, because the right brain starts to sending the information to the left brain what you are doing. The right side is going to control the left side, left is going to control the right side. So where there is a good communication between the right and the left one, so that communication is there for the corpus callosum. It is about 10 centimeter long. So it is about two ends, it is having the two ends are there. One is an anterior end, another one is an posterior end is there. Other parts are there: splenium, trunk, genu, and the rostrum. Trunk is the central portion, splenium is the portion what you are saying, genu is an bend is there, that you have to identify. And from this, the extension of the corpus callosum is there in the name of the forceps minor as well as a forceps major. So these are not the forceps of the dissection used. These are the forceps major, the fibers which runs in the white matter there. This is a diagram where you can identify the forceps major and the forceps minor thing. So 5 marks point of view, you have to write it for the corpus callosum. Uh, After this, you try to remember the applied aspect also. Especially in the nervous system, when you are studying from the cerebrum point of view, try to functional areas as well as some topics, try to learn the clinical anatomy. That will create some interest in you to study the corpus callosum. In the corpus callosum, there is a syndrome called split brain syndrome. The split brain syndrome, what happens there, the right side, what right hand is doing, the left doesn't know, because the communication is going to be lost in case of any injury or any problem with the corpus callosum. Sometimes congenital absence will be there. If it is a congenital absence, there is no coordination. Such people is difficulty to manage from both hands. If you right hand, if you are doing something work with the right hand, if it is heavier, automatically your left hand will come for your help, automatically will come. But the person with the congenital absence of the corpus callosum, there is no coordination between the right hand and the left hand. The fine movements which is possible with the help of the right and left hand is not at all possible in case of the congenital absence, where the corpus callosum is not there. Sometimes to reduce the surgical growth, if some surgical growth has happened in the in that areas, to reduce that one, they are going to remove. Remember, the neurons are not, they will not grow once the neuron is fixed. Brain tumor, what you are all studied, this is all neuroglia. There are two types of the cells are present in the nervous system. One is the neurons and the neuroglia are there. Different type of the neuroglia are there. These neuroglia grow in a multiple number. They grow in a multiple number, whereas the neurons are constant. Except some neurons, they will not. Once the neuron destroyed means destroyed. There is no further growth in that one. Whereas the neuroglia are there, they are chances of increasing in its number. So if they increase in its more number, tumor is there at that time, some surgical removal of that part is there at that time. If uh, corpus callosum is removed, then split brain syndrome may seen. So try to identify some clinical aspect, then it will be helpful to understand. So I had just collected some matter how to write it in the exam point of view. So anterior commissure, posterior commissure, one part, how it is connected. Like that in simple single words, you try to focus. I'm not going to read all those things. Okay. Whereas in projection fibers, there is one more important structures will come. It is called as the internal capsule. Internal capsule. So projection fibers, what the name indicates, they will project. They will project here. Into projection fibers are there. They collect the information, whatever the information from the basal ganglia or their thalamus or the outside the CNS. All this information will collected and reaching to the cerebral cortex through the projection fibers. Among that, one is the corona radiata. So not this COVID, this is different one. This is a corona radiata. Here, in the radiation form, they are going to spread. They spread like anything. They will spread like completely the cerebral portion to. There is an intersection between the corona radiata and the internal capsules in some places also there. So that we'll see in the further slides. So the corona radiata is a one type of the projection fibers which is going to communicate. So most of the fibers are coming from the relay center called as an thalamus. It is a very important relay center in the brain. So except the olfaction, all the four sensory information has to pass through the thalamus only. All the four information. So among that, very important, among the projection, among the commissural fibers, the corpus callosum is important. Among the projection fibers, internal capsule is very important. The internal capsule is 5 marks point of view. It is important by because clinical aspect, stroke, I think most of you are hearing that. So this person got stroke, stroke is there, paralysis is there, like this. Why this most of the injuries are going to arterial blood, it is going to be ruptured, or this part is going to be damaged related to the highway. It is an internal capsule is like an highway in the brain. So you should know this very well clearly. So it is a compact band. What is this? What is this? What called as an? It is a sorry. So it is a compact band of the nerve fibers are there, neocortical fibers are there. It is a main highway for the input and the output fibers for the cerebral cortex. It continues above as a corona radiata and below as a crus cerebri of the midbrain. It is an V-shaped in horizontal section with the concavity of the lateral. So this simple diagram, practice this diagram. Why? Because so if you practice this diagram, you can use this diagram when you asked to write about thalamus. Draw this diagram. Tell the show the relation with the thalamus and the internal capsule. In the caudate nucleus, lentiform nucleus, that is the basal ganglia. That diagram also you can use it. Internal capsule, this diagram can be used. The same diagram can be utilized in multiple places. Try to choose such diagrams here. So relations, when you see medial side, head of the caudate nucleus and the thalamus, lateral side, the lentiform nucleus, V-shaped one. This internal capsule is being divided into portions are there: anterior limb, genu, posterior limb, retrolentiform part, and the sublentiform part. Below the lentiform nucleus, these are the five parts of the internal capsule. Very important one. So try to remember the parts of the internal capsule. And in the internal capsule, the arrangement of the fibers, this is little bit further study is there. So I will not focus right now on this topic right now because it takes some time to explain here. So to draw a diagram where you can able to identify how the arrangement of the fibers, how these fibers has been arranged, what is their functions. So why this arrangement is here, or arrangement in the genome, arrangement in the limb, individual areas, the different arrangements of the. Try to read it. I have not included the clinical aspect of that one. I have not included that one because it takes it is taking a little bit more time. So, um, so Madam, Chaitra madam. Hello,
Yes,
madam.
sir. Yes,
Madam,
sir.
madam, it's already 11:30. My
Oh,
slides are more, little bit more and more.
okay,
Uh,
sir. You can
uh,
conclude, sir.
yeah, okay.
Okay.
I'll
Okay.
tell my students to that. So try to study the clinical anatomy more rather than simple just anatomy. While studying the anatomy part, especially in the nervous system, focus on the previous year question papers, note down the questions, try to solve that one, use the simple diagrams to explain more, use the single diagrams to in multiple places to get more marks, try to write down the flow charts, it will be helpful. uh, I thank very much for the Sarveshkar sir and Shelly sir and Alka madam and Chaitra madam for inviting me for this seminar. I know I couldn't complete this topic because I know it's a huge one, but students with the patiently they have listened. At least some few points they have got. If any doubts or anything there, so they can contact me, and definitely I am going to help them. So I can share this PPT to them. This is a simple thing. Well, it's a short form. I have made it and just forward to you. You can share it to madam. So thank you, madam. Thank you for giving an opportunity, madam.
Thank you so much, sir, for such a wonderful session. Actually, CNS is a vast subject, so
Yes,
it will
madam.
take more time. So within a short time, you have completed the important points in the view of examination. So thank you so much, sir. Behalf of Department of Sharir Rachana, we are very grateful to you, sir. Thank you.
Thank you, madam. Thank you. Thank you.
So at the end, I thank all of you for your active participation in guest lecture on exam orientation program Rachanavadhana 2020. Tomorrow on 31st December 2020, we have Dr. Prasanna sir, Associate Professor, Department of Sharira Rachana, SDM College of Ayurveda and Hospital, Hassan. Sir will be talking on the topic male reproductive system. Thank you one and all.
Thank you, madam.